It's one of the most widely prescribed antibiotics in the country, but the side effects could lead to death.
And 4 years after I-Team investigator Jackie Calloway first told you about this danger, experts are now calling for tighter controls on some prescriptions to protect the public.
She was just beautiful. She was intelligent, vibrant, and happy.
Deanna Pogan was a happily married mother of two who loved life, according to her mom.
She lit up a room when she came in.
911, what's your emergency?
But on Christmas Eve 2015, witnesses say Deanna walked into traffic near her home.
It appears to be that the person was struck by a car.
She parked her car on the side of the interstate and walked in front of a semi.
Deanna's family blames her suicide on side effects from a popular antibiotic, Cipro, which she began taking just 4 months before her death.
It was not her. She would have never, ever, ever done something like that.
Cipro is one of the brand names for a class of antibiotics known as fluoroquinolones. Another brand name? Levaquin. Since 2015, the FDA has recognized a syndrome related to taking these drugs. It's called fluoroquinolone-associated disability, or FQAD. The FDA added black box warnings to these drugs, citing disabling and potentially irreversible physical and mental side effects. But experts say no one's reading that warning, buried in this 35-page insert.
We have suicides after 1 or 2 days of the antibiotics.
Dr. Charles Bennett, a nationally recognized medication safety expert, says it's a big problem.
The risks outweigh the benefits.
The I-Team reviewed the FDA's own data. It shows more than 20,000 reports of psychiatric side effects like anxiety and depression, and 174 suicides connected to these antibiotics in the last 20 years. U.S. doctors wrote 29.7 million prescriptions for these drugs in 2016 alone, according to the CDC. Dr. Bennett has filed a petition with the FDA asking that doctors who prescribe this medicine get patients to sign a release that they understand the risks before taking it.
I was not given that choice.
Lori Walls says it felt like a bomb went off in her body and mind 3 days after her doctor prescribed Cipro for a sinus infection.
What's the worst part of your symptoms?
The anxiety, my muscles and my joints, depression.
Lori says taking the antibiotics, she no longer travels long distances to see family or take part in her favorite hobby, karaoke.
I never in a million years thought an antibiotic would do this to a person.
She told me she'd never experienced suicidal thoughts before she took Cipro in 2017.
Does this scare you?
Mm-hmm. Because I don't want to die.
The FDA told us it's reviewing Dr. Bennett's request for a new warning, saying it's important that healthcare providers and patients are aware of both the risks and benefits of fluoroquinolones. The FDA could take more than a year to make a decision on Dr. Bennett's request. We reached out to Bayer, which makes Cipro. The drug maker says the antibiotic is an important class of medications that treat a wide range of bacterial infections, many of which are serious and can be life-threatening. The company told us it closely monitors the safety of the drug and encourages patients to discuss the risks and benefits of these medications with their doctor. The drug maker Janssen is no longer making Levaquin, but the drug is still available in generic form.
My daughter's death cannot be in vain, and nobody else can suffer something like this. It's just unconscionable for this to be happening when the information is out there.
I'm I-Team reporter Jackie Calloway, taking action for you.